We begin with the latest developments in the conflict in the Middle East. Israel's military says its forces have entered Gaza's biggest hospital, Al-Shifa, the site of a long standoff. The Israel Defense Forces say specially trained troops are carrying out a precise, targeted operation against Hamas in a specific area of the hospital. Both sides say Israel gave it a warning that it would raid the hospital. Israeli officials also said they are taking steps to avoid civilian casualties. Earlier, we spoke with Peter Lerner of the Israel Defense Forces. He told us more about the operation.
It is an operation that we are carrying out based on intelligence information. It is a precise, targeted operation in a specific part of the Al-Shifa complex. And indeed, we are conducting this operation as part of our broader efforts in order to dismantle Hamas and its terrorist infrastructure, and also retrieve and bring home the hostages. So we're conducting this operation overnight in order to achieve those goals. Indeed, it is a huge challenge within the hospital complex. We have conducted extensive efforts over the last few days in order to evacuate the hospital, in order to get people out of harm's way. And that's despite Hamas's efforts to keep people in harm's way. As we went into the compound, the complex, we instructed people, the uninvolved, to keep away from the windows and to take cover. Indeed, the operation is ongoing. We are conducting our operations in order to distinguish the civilian component, keeping the civilians out of harm's way, trying to minimize the effect of our operation on them. But there is a military necessity, and nevertheless, because of how Hamas has utilized hospitals. Yesterday, we shared with the world how they turned the Rantisi hospital into a command and control position, perhaps even holding hostages there. And this is just another part of that operation in order to degrade, destroy, and dismantle Hamas's terrorist infrastructure.
Now, let's get more on the humanitarian situation in Gaza. We can speak now with James Denselow. He is the head of conflict and humanitarian policy at Save the Children UK. Thanks for being with us. First of all, tell us what you make of the Israeli military operation inside the Al-Shifa Hospital in Gaza City.
Well, I think all eyes are on Shifa Hospital, and to see the scenes that we're seeing from hospitals that do have protected statuses under international law, to see mass graves in these hospitals, to see neonatal units shut and newborn babies, premature babies taken out. Several have died. And I think in a way, the fate of those babies is a litmus test of the international order, our ability to get aid into them, an ability to protect them, and an ability to save their lives. So I think all eyes are understandably on Shifa Hospital this morning, but let's not forget there are tens of thousands of Palestinians, tens of thousands of children still in the north of Gaza who have been cut off from even the small amount of aid that has been managing to get into Gaza since the 7th of October and the horrendous events that happened then. So it's a really desperate time, and we're hearing about a public health crisis, which is adding, of course, to the high death toll and injury toll, which hasn't been updated since Friday. So we don't really know what the consequences of this are.
The Al-Shifa Hospital in Gaza City is the largest medical hospital in Gaza, I understand. Is it possible for medical personnel to provide care in this situation?
Well, the WHO has said that Al-Shifa Hospital, as well as half of Gaza's hospitals, have ceased to function as hospitals. And I think the key question, which goes back to one of your previous interviews, Terry, with an IDF representative, is the question about if you can evacuate hospitals, where do you evacuate them to? I remember in the Mosul operation several years ago, there was a lot of field hospitals close to the front line so that once civilians came out of ISIS-controlled areas, they could be treated there. But if you evacuate very injured people from hospitals but do not take them to other medical facilities or other hospitals, then you're essentially signing a death warrant to them. So there's a huge kind of missing question there about what happens when you evacuate Gaza's hospitals, which are under incredible strain, as you can imagine, from the thousands of of people who've been injured. And these are serious injuries, crush injuries, blast injuries, life-changing injuries for children, loss of limbs, loss of organ function that they will carry for the rest of their lives.
James, if you could sit down with the warring parties yourself at a table, what would you say to them directly?
Well, I would try and explain to them that the heaviest burden of this conflict is on the smallest shoulders of the 1 million children in Gaza, let alone the children that have been taken into Gaza and are being held hostage. Children are paying the ultimate price for this conflict. And all I could try and hope for is that adults see in the despair of children the need to de-escalate and find a way towards an effective humanitarian ceasefire that allows us as aid workers to do our job, to reach children with clean water, with food, with medical help, with all the protection services they so desperately need, because that isn't happening at the moment. And of course, the toll is absolutely devastating.
We know that children are the most vulnerable members of society, and in wars they are extremely vulnerable. But in this particular conflict, children seem to be disproportionately affected. How do you account for that?
Well, unlike other high-intensity urban battles that we've seen over the last decade, the key element to the protection of children has been the evacuation of children, the movement of children away from the front lines of a conflict, whether that's in Bakhmut or in Aleppo or in Mosul. That has not been possible in Gaza because the population is trapped, generally, more or less. I mean, there's been a few people come out, dual nationals, a few injured, but very small numbers. So the majority of the population, a very large child population of over 1 million Gazan children, has not been able to leave an area that has been completely unsafe. There's no safe place in Gaza. There's no deconflicted space. And of course, when you see the largest hospital being raided as it is, that is testament to that. So I think that explains the high numbers of children who've been caught up in this. And that, again, should be a real clarion call to action from the international community.
James, thank you very much for taking time to talk with us today. That was James Denselow at Save the Children UK. Let's cross over now to Jerusalem. Correspondent Sami Sockol is standing by there. Sami, what's the latest on the situation at that hospital in Gaza?
Well, we know that the forces entered the Gaza Shifa complex. Now, it's quite a large complex. This is the largest hospital in Gaza City and in the Gaza Strip. And the operation is taking part in certain areas of this hospital. And from what we know, there's been no exchange of fire. That means there has been no resistance to the entrance of the Israeli soldiers. Hamas is saying this is just a proof that there are no fighters over there. Yet we also heard that there have been some explosions in the complex. The report is that in the western part of the hospital, the forces have tried to blow up some doors. So maybe they're trying to reach a certain area where they do believe that there might be Hamas fighters, or even what Israel has said that maybe some of the hostages are held there. But I think we'll have to see whether these claims of an existence of a command center of Hamas, they will actually find it or not.
We know that the hospital had not been fully evacuated. Some people had apparently sought refuge there. There were still patients there. What are you hearing about the number of civilians that are still in the hospital?
We don't know exactly the numbers for sure. We don't have the same. We had tens of thousands that were both inside the complex and surrounding the complex. Apparently, those numbers have definitely gone down, but I don't have exact figures. I mean, the only number I can quote is the 630 patients that are being treated inside the Shifa Hospital.
U.S. President Joe Biden has urged Israel to protect civilians at Al-Shifa Hospital and use, quote, less intrusive tactics. Is that likely to have any influence on military operations, Sami?
Well, in Israel, they're saying that they're going to continue with this military campaign. We're talking about a long military campaign in the Gaza Strip, a campaign that will last for many more months. This campaign is now in the city of Gaza, and the next stage will be when the Israeli forces will be going down south. And we're expected to have a very long campaign. And they are already saying now, and we're hearing Israeli ministers say that we know that the international criticism will grow. The Israeli foreign minister said to journalists that he expects there to be international pressure on Israel in 2 or 3 weeks. And nevertheless, he's also said, because he was criticized by others in the government for even talking about international pressure, that Israel is going to continue this military campaign in spite of the international pressure and in spite of criticism that will come from the United States. Having said that, the Americans did agree with Israel that inside the Al-Shifa Hospital there is a Hamas military presence. This is, of course, something that Hamas also reacted to. They came out with a statement saying that this is not true, that the Americans are actually backing Israel with this attack against Shifa, and they're inviting the United Nations to investigate and find out whether there are Hamas military presence in the hospital.
Sami, thank you very much for that update. That was correspondent Sami Sockol in Jerusalem.